It was sold as a solution to Canberra's critical emergency department woes, but it now seems that the nurse-run walk-in centre at the Canberra Hospital is actually making the problem worse. As Craig Allen reports, doctors at the coalface say the model just hasn't worked.
It's a slap in the face for a government desperate for solutions to an accident and emergency backlog.
Something that's being sold as a cure for emergency department overcrowding is in fact making the problem worse.
The government opened Australia's first walk-in centre in May, just a stone's throw from accident and emergency at Canberra Hospital, and staffed by nurses to treat minor injuries and illnesses. But while the clinic was meant to relieve the load on the emergency department, that's exactly where some patients are ending up.
The majority of cases that spill over are minor cases. They're a little bit too complex for the walk-in centre, but they are nowhere near as complex or as sick as the average patient in the emergency department.
Drew Richardson says the problem is the clinic's location. It's just too close to A&E.
The Health Minister said that only 3 a day get referred to the emergency department, but of course being co-located, many more will take the convenience of that location to go there anyway.
The government agrees the site's not perfect, but it was done to win doctors over.
The only way we could get their grudging support, and it was grudging support at the time, was to co-locate it under the governance of the Canberra Hospital.
The Health Minister doesn't readily accept the figures, but Drew Richardson says an extra 35 patients a week have come through accident and emergency since the clinic opened.
And the Minister actually needs to take this latest report from Professor Richardson very seriously. She needs to look at the facts and she needs to address it, not dismiss it.
And Drew Richardson also has some blunt advice.
Don't say that it's going to reduce emergency department workload because there's clear evidence that it doesn't.
Ms Gallagher says she'll wait for a 12-month independent review of the clinic, although that's not due till mid-next year. Craig Allen, ABC News, Canberra.